This presentation is on exercise for psoriatic disease. My name is Laura Passalent. I'm a physiotherapist practitioner with the Schroeder Arthritis Institute at the University Health Network. I am an assistant professor with the Department of Physical Therapy at the University of Toronto, and I'm a clinician investigator with the Krembil Research Institute. This presentation was originally provided live to the Canadian Psoriasis Network Patient Forum on September 12, 2023. The objectives of this talk are to review why it is important to exercise, what exercises people with psoriatic disease should be engaged in, and how best to engage in regular exercise. First, we will start with why it is important to exercise. We have known the benefits of exercise going back to the 5th century BC. In fact, Hippocrates, who is the original physician, once stated that eating alone will not keep a man well. He must also take exercise, for food and exercise work together to produce health. The benefits of exercise are well known for psoriatic disease. We know that exercise can increase mobility, strength, cardiovascular fitness, daily function, sleep, well-being, and quality of life. We also know that exercise can reduce pain, tenderness, and morning stiffness. Exercise is also known to prevent other chronic diseases that may be associated with psoriatic disease. As well, for people with psoriatic arthritis, it is also known to reduce joint and prevent joint deformity. Focus on the impact of exercise on psoriasis. We know that exercise can actually improve psoriatic lesions. This recent systematic review, which was published last year, looked at a number of different studies examining the risks or odds of developing psoriasis in patients in exercise, and found that those people who were engaged in less exercise had a higher incidence of psoriasis, and those patients who were engaged in regular exercise had a reduced risk of having psoriasis. If we look at treatment guidelines for psoriatic arthritis, physiotherapy and exercise are recommended as first-line treatment through the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, or the GRAPPA group. We know that exercise is essential at addressing the metabolic risk factors we often see in people with psoriatic disease, including obesity, non-alcoholic fatty liver, hyperlipidemia, which is also known as high cholesterol, hypertension or high blood pressure, and diabetes. A systematic review published in 2021 assessed the effects of physical activity in psoriatic arthritis, and again found positive impact with respect to cardiovascular risk reduction, improvement in quality life, reduction in pain and fatigue, and reduced disease activity. It also showed that there was increase in muscle strengthening. Next, we're going to discuss what exercises we should be engaged in with psoriatic disease. The American College of Sports Medicine published a position stand in 2011 on the different types of exercises that people should be involved in order to gain physiological benefit. This position stand stated that the scientific evidence demonstrating the beneficial effects of exercise is indisputable. A program of regular exercise that includes cardiorespiratory, resistance, flexibility, and neuromotor exercise training beyond activities of daily living are essential for most adults. I've emphasized beyond activities of daily living here because exercise, in order to gain the benefits, needs to be purposeful and structured. So based on these guidelines, the American College of Sports Medicine published recommendations in terms of frequency, intensity, and duration of the various forms of exercises that should be conducted in order to gain the health benefits. We will be going into each of these individually, but I wanted to highlight what neuromotor exercise is. Neuromotor exercise is strengthening that is conducted in a functional way. So for example, if we were to strengthen our lower extremity using squats, for example, that are being performed with weights and using biomechanically correct technique, we would be strengthening the lower extremity muscles in such a way that this would translate into function such as getting in and out of a chair, going up and down stairs, or bending over to pick things up off the floor. In addition to the importance of these various forms of exercise, of posture. I want to digress slightly and just talk a little bit about what happens to your neck and posture when you are on a mobile device. So if we see on the left-hand side here, this individual has their head in a neutral position, and the head weighs approximately 5 kilograms or roughly 12 pounds in a neutral position. Most people will look at their mobile device with their neck angled at approximately 45 degrees, which is roughly 50 pounds. This is a significant weight that the neck and all the small stabilizing muscles need to hold on to in order to support the neck. So you can imagine how this can translate into significant pain and discomfort. So here's some examples of proper posture that we should consider. So for example, when you're sitting, you want to make sure that you're sitting with feet flat on the floor and with your buttocks right to the back of the chair. You can add a lumbar roll or a rolled up towel to help to provide some support of the lumbar spine. We want to try to avoid this sort of hunched forward posture. Standing desks are great because they break up the movement and take some stress and strain off of the low back and joints. And then finally, when we're picking up and lifting things up off the floor, we need to be cognizant to be sure that we're doing this with our lower extremity and not flexing our back. I promote what's called the 30-minute rule. So what this means is that if we're finding ourselves in any sustained posture, we shouldn't hold that posture for more than 30 minutes. So if you're sitting at your desk, just make sure that you set an alarm to go off at roughly 30 minutes so that you can just simply stand up to break the movement. You can do a stretch, you can go get a drink of water, and then sit right back down. So we shouldn't be sustaining any particular postures for more than 30 minutes in duration if we want to avoid wear and tear on our joints. So the next set of slides are going to go into a little bit more detail around the different forms of exercise that target the different body systems. So we're going to talk a little bit about stretching, strengthening, and physical activity or cardiovascular fitness. When it comes to stretching, we need to make sure that when we stretch, that we are respecting the pain. It's important to take the stretch to the point of discomfort, but not to go into the point of pain. So very often I will suggest people take their stretch to that point where it's about a 4 out of 10 on a pain scale and not go beyond that. If you look at the recommendations from the American College of Sports Medicine, they actually suggest stretching approximately 3 days a week. And certainly this can be seen as a minimum. However, sometimes people particularly with psoriatic arthritis, are quite stiff and may find that engaging in a daily stretching program is beneficial, particularly first thing in the morning, to help combat early morning stiffness. Stretching should be slow and prolonged. There should be no bouncing involved. The stretch should be sustained for approximately 20 seconds, and you should be repeating the move at least 2 to 3 times per muscle group. The other thing I want to emphasize is that it's important to breathe throughout the stretch. Exhale as you get to the end of the stretch to help improve the quality and quantity of the stretch. So here are some examples of different types of stretches for the lower extremities. So this is knees to chest. So this is a back-friendly way to stretch the low back, the hips, and the knees, sort of all in one shot. Another good example is a hip flexor stretch that is done in half kneeling. And then the hamstring stretch that we see here, again, this is a nice back-friendly way to do a hamstring stretch, lying on the back with the opposite leg bent and using a band or a belt, something firm, not stretchy. Work on stretching both the hamstrings, which are located behind the thigh, but you also get some gastroc stretch here as well. Here we have some examples of stretching of the small joints of the hands. This is important, particularly if you have psoriatic arthritis with small joint involvement. And we can see here the various types of range of motion that we can go through at the different joints within the hands. So at the knuckles, as well as the joints within the fingers, and also the thumb. Next, we're going to talk about strengthening. So in order to build muscle strength, we should be engaging in strengthening exercises at least 3 times a week. We want to ensure correct posture when we're doing the exercise. This is really important to make sure the technique is correct. Otherwise, we just keep strengthening muscles that are already strong, and weak muscles continue to be weak. This is equally important, ensuring correct muscle activation. So again, just making sure that our technique is correct. And again, it's really important to progress from remedial to advanced. So once you can master a certain strengthening exercise, it's important to take it to the next level to continue to build muscle. As a start, you should be doing 10 to 15 repetitions, at least one set. You can build up to 2 or 3 sets depending on how you feel. The last few repetitions should be quite difficult, and this will help you gauge the appropriate weight to be using for strengthening. And it's important to focus on both the core muscles, so these are the muscles in the along the stomach and abdominal area, as well as the back. In addition, it's really important, particularly for those individuals with psoriatic arthritis, to be focusing on joint stability. So the muscles that support the joint, for example, the knees, the hips, and shoulders. This is some examples of basic core strengthening. So we have bird dog here that really works on both the back muscles and the abdominal muscles, as well as dead bug. Again, similarly, it's working on lower abdominals mostly. This is an example of lower extremity strengthening, so squats. So if you recall from the slide previous, this is an example of neuromotor strengthening because it translates into functional activities such as getting in and out of a chair. This is an example where we really need to focus on appropriate, correct posture and correct muscle activation. So here is the correct way to do a squat, where your knees are over your first and second toe. You want to make sure that your knees are not too far out or not too far in, or you're going to cause injury and pain to the knee joint and potentially the hips as well. So this is exactly what we mean when we talk about the importance of appropriate technique and muscle activation. And here we have just some examples of peripheral joint strengthening. So for the small joints, or sorry, the small muscles of the hands. A squeezy ball is really good to strengthen um, the hand and work on range of motion of the small joints of the hands. This again will translate into improving your functional grip. And then here we just have an example of press ups where we're working the muscles that move the elbow as well as the shoulder. So next we're going to move on to cardiovascular fitness or physical activity. Physical activity is any movement that you're engaged in throughout the day. This could include what you do for work. It could include house chores. It could include leisure and recreational activities, sports, how you commute back and forth to work, in addition to purposeful exercise. In order to gain the health benefits from physical activity, you need to be engaged in a moderate level of aerobic intensity for at least 150 minutes per week, or at least 75 minutes of high aerobic intensity. So this slide outlines some examples of moderate intensity physical activity. This could include brisk walking, water aerobics, doubles tennis, general gardening. We also have some examples of vigorous intensity, such as singles tennis, aerobic dancing, jogging, hiking. What I like to, or how I like to simplify this rather, is through the talk test. So if you're engaged in some form of physical activity, you're sweating, but you're able to maintain a conversation, you're likely engaged in moderate aerobic intensity. However, if you're engaged in a form of physical activity where you're sweating and you're unable to converse, it's more likely vigorous aerobic intensity. And engagement in regular physical activity is recommended for people with both inflammatory arthritis and osteoarthritis. This is the 2018 EULAR recommendations. So this is a group with expertise in rheumatic disease in Europe, and they published these recommendations that include the 4 domains that we spoke about through the American College of Sports Medicine, that really focuses on cardiorespiratory fitness, muscle strengthening, flexibility, and neuromotor performance. And this slide again just provides you with examples of physical activity, as mentioned earlier, that it can include anything from purposeful walking to sporting activities, chores, how you get to and from work, as well as a home stretching and strengthening program. I just want to mention other forms of exercise such as yoga, Pilates, and Tai Chi. So these have been studied extensively in inflammatory arthritis such as psoriatic arthritis. And the advantage of these forms of exercise is that they combine the various forms of stretching, strengthening. They address posture, and some of them even address a cardiovascular component. So, for example, in yoga and with the sun salutation, where you're performing repeated asanas over and over again, you can get a cardiovascular component. So it is good to remember that, you know, as a home program or a program that you conduct at the gym is good, but there are other forms of exercise that can also benefit your exercise program. And swimming is another form of exercise that has that sort of combined effect of cardiovascular fitness, core strengthening, and flexibility. Um, it's fine for people with psoriasis to engage in regular swimming. Some people find that their skin may dry out a little bit more, so it is important to maintain moisture with topical agents. Some people with psoriatic arthritis can get back involvement, and we tend to see it more in the neck than low back. So, you know, modifying how you engage in your exercise program is important. So this is an example of an individual who may not be able to turn their neck to perform front crawl. So these are these training snorkels that you can use to keep your head in a more neutral, or sorry, your neck in a more neutral position. So the last thing I'm going to address in this talk is how to go about engaging in a regular exercise program. So one of the things that I think is important if you're first starting out is to really avoid that boom bust cycle. So what we mean by this is the individual who, may not be used to exercising, or may be have been an athlete in their past but have not been able to engage in regular exercise. So they may be out of shape, and you may find that there are periods where your psoriasis or your psoriatic arthritis is doing quite well. And that's typically when people tend to overdo it. And they'll, maybe run for 5 kilometers if they haven't run in 5 years. And all of a sudden they're going to flare up their arthritis, but they're also going to have secondary pain because they're just not used to performing that activity. So what then happens is that they kind of fall into this flare and this trough where they're reducing their activity level, and then they'll feel better again and again overdo it, and they end up in this cycle where they overdo it, they feel pain, they stop activity, and over time their activity level starts to decrease. And this is what we refer to as the boom bust cycle. So instead, we suggest that you approach exercise at a slow and steady pace. And so what we mean by this is, engaging in an activity where you're going at it slow, and you're slowly increasing the difficulty, the distance, the duration of whatever activity it is that you're doing over time. And you do this regardless of how you're feeling. So if you're feeling, not so great, you still push yourself. But if you're feeling really good, you don't overdo it. And this will certainly set you up for success in terms of engaging in regular exercise. So a common question we often get is, what do I do if I'm in a flare? So for people with psoriatic arthritis, if you are in a flare, it is important to isolate or rest the affected joints. So if you're getting a flare in your hands, but your lower extremity is preserved, it's still okay to go for that walk or maybe do some light exercise in the lower extremities. You can apply ice or heat, it doesn't really matter in terms of um, helping soothe the joints that may be flared up. It will be important to maintain range of motion within a pain-free range. So again, gentle range of motion exercise. You may find that you have to modify some activities, but when that flare is starting to subside, it's really important to gradually return to your exercise program. So I'm getting to the end of the talk now, but I just wanted to include this interesting reference from Harvard Magazine published in 2016. And it really talks about how, humans evolved with a very large stick. If you didn't exercise, if you weren't active hunting and gathering, you really had nothing to eat. And exercise was absolutely mandatory for survivals. The problem is that for many humans today, there are very few incentives and no penalties for activity. But we know that study after study shows that there's actually no trade-off. And so the more time we spend exercising, that time is not lost, but it's actually returned in spades because of the numerous health benefits that we know in the general population, but also there's so much evidence, as mentioned earlier, to support the benefits of exercise in psoriatic disease. So I'm going to conclude the talk there and just end by saying the best exercise is the exercise that gets done. Thank you for your attention.